In the 2010s, Silicon Valley produced a medical invention scam worth billions. Theranos claimed it could run hundreds of blood tests from a single finger prick. The promise was faster results, lower costs, and easier access to diagnostics. Investors funded it. Politicians praised it. Retail partners prepared to deploy it to the public. By 2014, the company was valued at $9 billion. Its founder was presented as a visionary innovator. Demonstrations appeared controlled and convincing, but the breakthrough did not exist at the scale it claimed. This was not a temporary product delay. It was a system built to look like innovation while avoiding verification. This is Theranos, the fake invention scam that raised billions.
Theranos was founded in 2003 by Elizabeth Holmes. The company was built around a single claim. It asserted that hundreds of laboratory tests could be performed from a few drops of blood. The method was described as a simple finger prick. Traditional laboratory testing required vials of venous blood. It required centralized laboratories. It required trained phlebotomists. It required complex analytical equipment. Results often took hours or days. Costs could be significant for uninsured patients. Theranos presented itself as a technological simplification. It framed blood testing as unnecessarily complex. The company suggested that miniaturization could transform diagnostics. In theory, smaller devices could reduce cost. Faster processing could improve clinical decision speed. Greater access could expand preventative care. The promise aligned with Silicon Valley logic. Technology was expected to make systems smaller and cheaper. The analogy to consumer electronics was implicit. If computers could shrink, laboratories could shrink. The idea sounded inevitable. Medical testing, however, is chemically sensitive. Blood contains multiple analytes in varying concentrations. Different tests require different preparation methods. Sample integrity affects accuracy. Temperature, handling, and contamination matter. Dilution changes measurement reliability. Some tests require plasma separation. Others require whole blood. Analytical machines are calibrated for volume consistency. Miniaturization introduces error margins. Clinical reliability depends on validation studies. In 2007, Theranos began refining its internal prototype. By 2010, it claimed major technical progress. Public messaging focused on disruption. The company described traditional labs as outdated. The term revolution appeared frequently in interviews. However, peer-reviewed data was limited. Independent validation was not published. The core claim required proof at scale. Performing one accurate test is not equivalent to performing hundreds. Precision across panels is more difficult than single assay accuracy. The promise combined cost reduction with performance expansion. That combination is rare in clinical chemistry. Nevertheless, the narrative resonated. Investors heard efficiency. Patients heard convenience. Retail partners heard traffic growth. The idea solved multiple problems simultaneously. When a claim solves many problems at once, scrutiny should increase. In the early 2010s, scrutiny did not dominate the conversation. The promise sounded technologically inevitable. The verification question remained secondary. The central claim was clear. If true, it would transform diagnostics. If unverified, it would transform perception instead. By the early 2010s, Theranos shifted from product development to narrative construction. The company understood that credibility precedes capital. Elizabeth Holmes cultivated a distinct public image. She adopted a consistent visual identity. She referenced long-term mission over short-term profit. Media profiles framed her as a visionary founder. Comparisons to established technology icons became common. Conference appearances increased visibility. Messaging emphasized transformation of healthcare. Technical specifics were limited in public forums. Instead, the focus was impact and scale. Authority was reinforced through board composition.
By 2011, Theranos had assembled a high-profile board. Members included former cabinet officials and military leaders. Few board members had laboratory diagnostics expertise. Their reputations provided institutional legitimacy. The board signaled seriousness rather than scientific validation. Investors interpreted presence as endorsement. Prestige substituted for technical scrutiny. The company operated largely in private markets. Financial disclosures were minimal. Valuation grew through private funding rounds. In 2013, Theranos began wider media engagement. Profiles appeared in major publications. The narrative emphasized youth and disruption. Holmes described the mission as democratizing healthcare. The Edison device was presented as proprietary breakthrough technology. Controlled demonstrations were arranged for select audiences. Visitors saw curated environments. Data was presented selectively. Access to full technical documentation was restricted. Employees were compartmentalized by department. Information flow was limited internally. Secrecy was framed as intellectual property protection. Investors were often bound by non-disclosure agreements. The combination of secrecy and prestige limited verification. In 2014, Theranos reached a valuation of approximately $9 billion. Holmes's personal stake made her one of the youngest self-made billionaires. Public recognition increased rapidly. Awards and speaking invitations multiplied. The story became self-reinforcing. Media coverage amplified investor confidence. Investor confidence amplified media coverage. The board's prominence reduced perceived risk. Few questioned the absence of peer-reviewed validation. Credibility was constructed before clinical proof was demonstrated at scale. Authority was visible. Data was not. The company had built a credibility machine. It operated through image, access, and prestige. Verification remained deferred. The perception of inevitability strengthened. The system now favored belief over examination.
Theranos described its technology as proprietary and confidential. Secrecy was presented as necessary to protect intellectual property. Employees were required to sign strict non-disclosure agreements. Internal teams were compartmentalized by function. Engineers did not have full visibility into laboratory operations. Laboratory staff did not have full visibility into engineering design. Information flowed vertically rather than laterally. Access to core technical documentation was restricted. External scientists were not permitted to inspect systems freely. Investors were shown controlled demonstrations. Demonstrations occurred in curated environments. Devices were presented as operational under supervision. Performance data was summarized rather than raw. Independent replication was not permitted. The Edison device was framed as trade secret protected. Patent filings were limited relative to claimed capability. Peer-reviewed publications were absent during early expansion. Requests for detailed validation data were deferred. Internal testing reportedly revealed variability. Some tests performed on conventional machines. Results were sometimes compared selectively. Small sample sizes were presented as proof of concept. Scale reliability was not publicly demonstrated. Employees who questioned methodology reported isolation. Legal pressure was used to discourage disclosure. Departing staff were reminded of confidentiality obligations. The culture prioritized message discipline. Public statements emphasized breakthrough language. Technical questions were redirected to proprietary claims. Regulatory classification was carefully structured. Theranos operated primarily as a laboratory service. This classification reduced certain device disclosure requirements. Laboratory-developed tests faced different oversight standards. The distinction limited external review. Retail partners relied on company representations. Data access was not independently audited at scale. Marketing materials focused on patient empowerment. Scientific transparency was secondary. The secrecy structure served multiple functions. It protected intellectual property claims. It prevented external verification. It reduced internal dissent visibility. It preserved valuation momentum. In venture markets, rapid growth can outpace scrutiny. Secrecy slows scrutiny. Controlled information shapes perception. When information is restricted, narrative fills the gap. The system became dependent on restricted access. Investors assumed that confidentiality implied innovation. Partners assumed that prestige implied validation. Secrecy transformed uncertainty into mystique. Mystique strengthened the brand. Verification remained postponed. The product claim continued expanding. Access to proof remained limited. In this structure, secrecy was not incidental. It was strategic.
Theranos centered its technology narrative on a device called Edison. The Edison was described as a compact automated laboratory. It was presented as capable of running hundreds of blood assays. Public demonstrations showcased sleek hardware. The device appeared self-contained and efficient. Investors were shown cartridges inserted into machines. Screens displayed organized result panels. However, prototypes and production-ready systems are not equivalent. A prototype can function under narrow conditions. Clinical diagnostics require consistency across varied samples. Reliability must hold under scale. Calibration drift affects measurement accuracy. Sample contamination affects outcome validity. Small volume testing amplifies variability. The Edison relied on microsample dilution techniques. Dilution increases measurement error margins. Different analytes require different preparation protocols. Running multiple assays on a single microsample increases complexity. Internal reports later indicated accuracy inconsistencies. Some tests were performed on conventional analyzers. In certain cases, finger prick samples were supplemented with venous blood. The presentation suggested full in-house automation. Operational reality was more fragmented. Demonstrations were tightly managed. Observers were not permitted unrestricted device access. Device internals were shielded from inspection. Software interfaces were controlled by company staff. Data displays were pre-configured. Performance variability was not openly discussed. The difference between demonstration and deployment widened. In engineering, demonstration proves possibility. Clinical deployment requires validation. Validation requires external replication. Replication requires open methodology. Theranos prioritized controlled demonstration. Independent verification was limited. By 2013, marketing expanded while validation remained incomplete. Retail deployment began despite unresolved reliability questions. The Edison became symbolic of innovation. Symbolism replaced transparency. Investors equated hardware presence with technical capability. Hardware presence does not guarantee performance. Medical diagnostics depend on reproducibility. Reproducibility depends on disclosed method. The prototype illusion functions by showing what appears operational. Scale reveals what is sustainable. In Theranos' case, scale introduced strain. Workarounds increased internally. Public messaging remained consistent. The prototype narrative remained intact. The gap between demo and dependable widened. That gap defined the illusion. In 2013, Theranos entered a major partnership with Walgreens. The agreement aimed to place Theranos testing centers inside retail pharmacies. The rollout began in Arizona. Patients could walk into stores and request blood tests. The retail setting signaled normalcy. Convenience implied reliability. Walgreens relied on representations provided by Theranos. Brand association transferred credibility. Customers interpreted presence as validation. Scale created perceived proof. If tests were available publicly, they were assumed to be verified. Retail employees were not laboratory scientists. They depended on company training. Marketing materials emphasized empowerment and affordability. Clinical details remained secondary in public messaging. The partnership accelerated exposure. By late 2013, dozens of retail locations offered testing. Theranos promoted broad test menus. The expansion preceded full independent validation. Retail deployment amplified investor confidence. Investors interpreted distribution as due diligence. Partners often trust institutional signals. Walgreens' brand reduced perceived risk. The logic was circular. Theranos gained credibility from Walgreens. Walgreens assumed credibility from Theranos' board and valuation. Scale substituted for scrutiny. Operational complexity increased. Test volumes expanded. Logistical strain increased internally. Quality control systems were tested under pressure. Patient results carried medical consequences. Reliability gaps became more significant at scale. Retail growth created public data exposure. Errors became harder to isolate. Yet public messaging remained optimistic. Expansion plans continued. Other retail discussions were explored. The partnership demonstrated how legitimacy can be outsourced. A respected partner lowers skepticism barriers. Visibility creates reassurance. Distribution can precede verification. When a product appears in trusted spaces, doubt decreases. The Walgreens rollout marked a structural turning point. Theranos moved from narrative to public interface. Public interface increases accountability. However, accountability requires verification. At this stage, verification remained incomplete. The scale of exposure increased risk. Brand transfer amplified expectation. The system now depended on operational consistency. Operational consistency was not fully established. Legitimacy had expanded faster than validation. The partnership strengthened perception. It also magnified eventual consequences.
Theranos operated within a complex regulatory environment. In the United States, medical devices and laboratories are regulated differently. Medical devices typically require review by the Food and Drug Administration. Laboratory-developed tests are primarily overseen under the Clinical Laboratory Improvement Amendments. Theranos positioned itself as a laboratory service. This classification reduced pre-market device scrutiny. The Edison device was framed as internal laboratory equipment. Internal equipment can face different disclosure requirements. Regulatory boundaries can create gaps. Gaps can delay oversight. By 2013, Theranos' retail expansion increased visibility. However, many tests were categorized as laboratory-developed. Laboratory-developed tests historically faced lighter review. This framework assumed good faith compliance. The regulatory model relied on periodic inspection. It did not assume systemic misrepresentation. In 2014, inspectors began reviewing laboratory practices more closely. Reports identified deficiencies in quality control. Documentation gaps were noted. Proficiency testing irregularities were observed. Regulatory letters were issued. The Centers for Medicare and Medicaid Services increased scrutiny. In 2015, compliance concerns intensified. Warnings highlighted potential patient risk. Regulatory processes are often reactive. They respond to signals. They rely on documented findings. Fast-moving narratives can outpace documentation cycles. Companies can expand before full audits occur. Regulators require evidence. Evidence requires access. Access requires transparency. Transparency was limited. The regulatory structure was not designed for secrecy-driven growth. It assumed disclosure norms. Theranos exploited classification boundaries. Device secrecy combined with laboratory categorization. This combination delayed unified oversight. Retail presence created public exposure before full regulatory alignment. The gap between innovation rhetoric and inspection findings widened. When oversight escalated, structural weaknesses became visible.
Regulatory blind spots do not create fraud, they create time. Time allows narratives to compound. Time allows valuations to increase. Time allows partnerships to expand. Once regulators act, momentum reverses. By late 2015, regulatory intervention intensified. The system began to correct. The correction followed scale. Scale had already amplified impact. Oversight lag had enabled growth. Growth had increased consequence. Regulation eventually converged with verification. By then, exposure was public. By 2013, Theranos had shifted from development narrative to capital acceleration. Valuation growth became central to the company's momentum. Private funding rounds increased in size. High net worth individuals were targeted. Family offices and prominent investors participated. Access to the deal became a signal of exclusivity. Scarcity increased perceived value. By 2014, Theranos was valued at approximately $9 billion. Elizabeth Holmes retained significant ownership. Her personal stake was estimated in the billions. The valuation was based on projected future dominance. Revenue remained limited relative to valuation. Financial models assumed rapid expansion. Investors relied on management presentations. Board prestige reduced perceived risk. Technical due diligence was often constrained. Access to full laboratory data was restricted. Non-disclosure agreements limited external review. Venture capital dynamics reward growth narratives. Missing a breakthrough opportunity carries reputational cost. Fear of missing out influences allocation decisions. Prestige investors attract additional investors. Capital inflow becomes self-reinforcing. Each funding round validated the previous one. Media coverage amplified valuation milestones. Valuation milestones amplified media coverage. The cycle strengthened belief. In private markets, disclosure requirements are limited. Information asymmetry can persist longer than in public markets. Investors compete for access. Competition reduces negotiation leverage. Independent replication of core claims did not occur. Instead, confidence was transferred through networks. Political endorsements added additional signaling. High-profile supporters increased perceived inevitability. The money engine depended on narrative continuity. Doubt threatens valuation. Valuation supports credibility. Credibility attracts more capital. Capital extends operational runway. Operational runway delays reckoning. Internal pressures to maintain story coherence increased. Performance gaps were managed through explanation. Short-term fixes substituted for systemic validation. Investor updates emphasized long-term transformation. Financial risk was reframed as innovation risk. Innovation risk is culturally tolerated in Silicon Valley. Clinical risk is less tolerant in healthcare. The distinction was blurred. The company's worth became tied to belief. As long as funding continued, scale expansion continued. The system rewarded persuasion. Verification lagged behind capital. When money flows faster than proof, illusion gains stability. By 2014, internal inconsistencies were becoming harder to contain. Some employees questioned the reliability of test results. Variability appeared across repeated runs. Certain assays produced inconsistent values. Workarounds were introduced to stabilize output. In some cases, conventional laboratory analyzers were used. Finger prick samples were diluted beyond optimal thresholds. Dilution increased error margins. Internal quality control flags were raised. Concerns were escalated through management channels. Responses emphasized confidentiality and alignment. Employees were reminded of mission and discretion. Compartmentalization limited cross-team awareness. Engineering and laboratory staff operated in silos. Information gaps prevented holistic review. Some staff members resigned. Departures increased through 2014 and 2015. Former employees began speaking privately to journalists. Internal morale showed strain. Public messaging remained unchanged. Retail testing continued in Arizona locations. Patients received results based on mixed processing methods. Some physicians questioned anomalies. Corrected reports were occasionally issued. Regulatory inspections intensified. Documentation irregularities were noted. Proficiency testing procedures drew scrutiny. The gap between internal data and external claims widened. Senior leadership maintained forward guidance. Investor updates emphasized long-term trajectory. Short-term reliability issues were framed as iterative development. The narrative remained consistent externally. Internally, pressure to meet expectations increased. Performance metrics were closely monitored. Communication controls tightened. Access to certain laboratories was restricted. Security practices increased. Employees described a culture of message discipline. Questions about validation were redirected. By mid-2015, tension between story and data had expanded. Operational strain created systemic risk. Reliability concerns became harder to isolate. Retail scale amplified exposure. Errors affected real patient decisions. The company's structure depended on narrative continuity. Internal contradictions threatened continuity. When internal alignment weakens, external stability becomes fragile. Information began moving beyond company boundaries. The first cracks were structural. They emerged from data. They were not narrative-driven. Verification pressure was increasing. Containment was becoming unsustainable. The system was approaching external confrontation.
In October 2015, investigative reporting altered the trajectory of Theranos. The Wall Street Journal published findings questioning test reliability. The reporting was led by journalist John Carreyrou. Former employees provided detailed accounts. They described the use of conventional analyzers. They questioned the accuracy of the Edison device. The publication triggered regulatory attention. Public claims were now under scrutiny. Independent verification became unavoidable. Theranos responded by disputing the report. The company defended its methodology. It emphasized proprietary protection. However, scrutiny intensified. The Centers for Medicare and Medicaid Services conducted inspections. Inspection findings cited significant deficiencies. Quality control failures were documented. Laboratory practices were questioned. In 2016, CMS imposed sanctions. Theranos' Newark laboratory license was revoked. The company was barred from operating certain facilities. Walgreens suspended testing operations. Retail partnerships began to dissolve. Investor confidence deteriorated rapidly. Valuation assumptions were reassessed. Board members began distancing from operations. Independent testing expectations expanded. Scientific communities demanded replicable data. Peer-reviewed publication remained limited. The core claim required external confirmation. External confirmation did not materialize. Media coverage broadened. Additional investigative reporting followed. The narrative shifted from disruption to doubt. Capital inflow slowed. Legal exposure increased. In 2016, the company voided thousands of test results. Patient impact became public. Regulatory oversight converged with public scrutiny. Verification replaced narrative momentum. Operational strain intensified. The business model contracted. Secrecy could not shield performance under inspection. When claims meet replicability demands, demonstration is insufficient. Clinical diagnostics require statistical consistency. Statistical consistency requires transparent validation. Theranos had scaled before validation. Now, validation was demanded. The confrontation between proof and promise became visible. The system had relied on belief. Belief was now tested by evidence. Verification had arrived. Narrative control weakened.
The structural turning point had occurred. By 2016, Theranos was in active contraction. Retail partnerships had been suspended. Walgreens terminated its relationship in June 2016. Testing operations were reduced significantly. Regulatory sanctions limited laboratory activity. Revenue projections were revised downward. Investor confidence eroded rapidly. Board members resigned. The company began restructuring efforts. Staff reductions followed. In 2016, Theranos voided approximately 2 years of test results. Thousands of patient reports were invalidated. Legal exposure increased. Civil lawsuits were filed by investors. Patients alleged harm from inaccurate results. The company denied intentional wrongdoing. In 2018, federal prosecutors filed criminal charges. Elizabeth Holmes and Sunny Balwani were indicted. Charges included wire fraud and conspiracy. The case centered on investor deception. The government argued that financial claims were misleading. The defense framed the issue as business failure. Court proceedings extended over multiple years. Evidence included internal communications. Investor presentations were scrutinized. Statements about device capability were compared to operational data. In 2021, the trial of Elizabeth Holmes began. Testimony focused on representations made to investors. Scientific validation gaps were presented in court. Internal knowledge of reliability issues was examined. In January 2022, Holmes was convicted on multiple counts of fraud. She was acquitted on certain other counts. In November 2022, she was sentenced to over 11 years in prison. Sunny Balwani was also convicted and sentenced. The verdict formalized accountability. Theranos, as a corporate entity, had already dissolved in 2018. The valuation had collapsed from $9 billion to zero. Investors absorbed substantial losses. The legal system assigned individual responsibility. Institutional partners reassessed oversight procedures. Venture capital firms reviewed due diligence practices. The collapse was not instantaneous. It followed progressive exposure. Narrative momentum reversed. Capital access disappeared. Operational continuity became impossible. The system that elevated the company unraveled. When verification overrides valuation, scale contracts. When credibility collapses, funding stops. The accountability phase followed exposure. The financial structure could not survive scrutiny. The illusion ended.
The Theranos case follows a recognizable structural pattern. It begins with a breakthrough promise. The promise addresses a real and costly problem. In this case, blood testing was complex and inconvenient. The solution was framed as technological inevitability. Miniaturization was assumed to equal simplification. The claim combined lower cost with higher performance. That combination attracts capital quickly. Credibility was constructed before verification. Prestige board members transferred authority. Media amplification substituted for peer review. Secrecy limited independent inspection. Controlled demonstrations replaced open testing. Prototype performance was treated as production reliability. Partnerships extended legitimacy outward. Retail rollout signaled validation to the public. Scale created perceived proof. Regulatory classification gaps delayed unified oversight. Laboratory categorization reduced device-level disclosure. Private market funding reduced transparency. Valuation growth reinforced belief. Investor competition limited skepticism. Fear of missing out influenced allocation decisions. Narrative continuity became financially valuable. Internal inconsistencies were managed rather than disclosed. Workarounds preserved outward stability. Verification was postponed. When independent scrutiny arrived, scale amplified impact. Regulatory inspection replaced curated demonstration. Legal proceedings replaced promotional interviews. The collapse revealed the gap between claim and capacity. The asset in this case was not infrastructure, it was credibility. Credibility functioned as collateral. As long as belief persisted, valuation persisted. When verification intervened, valuation evaporated. This pattern is not unique to healthcare.
Fake invention scams often share similar mechanics. A large promise anchors attention. Borrowed authority lowers skepticism. Secrecy prevents replication. Partnerships transfer legitimacy. Capital accelerates before proof stabilizes. Exposure occurs when independent verification becomes unavoidable. Collapse follows when funding depends on belief. The systemic lesson is procedural. Innovation requires validation. Validation requires transparency. Transparency requires access. Access enables replication. Replication distinguishes breakthrough from illusion. Innovation needs proof. Scams need time. The difference is verification.